Opioids. Just saying the word brings up these really powerful images, doesn't it? For some people, it means life-saving relief. For others, it's a devastating crisis. The truth is, these are some of the most effective and, most controversial molecules in all of modern medicine. So let's dive into this incredibly complex topic and see if we can figure out that balance between pain and pills.
And this is the central paradox of the whole story. On one hand, in places like the United States, we all know the overprescription of opioids has fueled a massive public health emergency. But then you look at many low- and middle-income countries, and the complete opposite is true. A lack of access means millions of people are left to just suffer from severe, untreated pain. It's really two sides of the same coin, a global mismanagement of one of our most powerful tools.
And the scale of this problem, it's just staggering. Think about it. Pain isn't some niche issue, it's a fundamental part of being human. More than a third of everybody on Earth lives with pain. And about 1 in 10 people will develop chronic pain each and every year. This is the universal problem that opioids were originally designed to solve.
So to really understand the solution, opioids, we first have to get a handle on the problem itself. What is pain, really? Turns out it's a lot more complicated than you might think.
Okay, check out this official definition. The word that just jumps out at me is emotional. See, pain isn't just a physical signal going off. It's this complex, totally subjective experience that involves distress and how we think about it and all this psychological suffering. It's not just what you feel, but how you feel about what you're feeling.
And this image shows that journey perfectly. So you get some kind of harmful stimulus. You stub your toe, whatever, and that triggers a signal. That signal zips up your spinal cord and into your brain, and the brain is where that signal is actually processed and interpreted as, ouch, that's pain. But what's really cool is that our bodies have their own built-in defense system, a pathway coming back down that can actually turn down the volume on those signals using our own natural painkillers, and that is where opioids enter the story.
So we just saw that our body has its own built-in defense against pain. How do opioids fit into that picture? Well, you can think of them as a way to supercharge that natural system. They're a powerful, engineered solution designed to jump in and intercept those pain signals before they completely overwhelm us.
So here's the key thing to get. Opioids are drugs that are designed to bind to very specific receptors in our nervous system. And get this, these are the exact same docking stations that our body's own natural painkillers, like endorphins, use. By activating these receptors, opioids produce incredibly potent pain relief. They're basically hijacking the system.
And here's what that looks like on a molecular level. An opioid molecule acts just like a key fitting into a lock, and that lock is the opioid receptor you see on the surface of the nerve cell. Now, when it binds, it doesn't just sit there. It triggers this whole chain reaction inside the cell. You can see those pathways on the diagram that ultimately blocks the cell from sending the pain signal forward. It's just an elegant and unbelievably powerful mechanism.
But, and you knew there was a but, right? Here's the twist. This super potent solution, when it's used improperly or for way too long, can create a whole new set of devastating problems. The very thing that makes opioids so effective is also what makes them so incredibly risky.
The whole clinical debate really boils down to this one distinction. For severe, acute pain, we're talking major surgery or a bad accident. The benefits of short-term opioid use are super clear and well-established. No one really argues with that. But for chronic, non-cancer pain, like long-term back pain or arthritis, the evidence that they work well long-term is surprisingly weak, and the risks go way, way up. This is where all the controversy really lives.
So what are those risks? Well, first, there's tolerance. That's where you need more and more of the drug to get the same effect. Then you've got physical dependence, where your body just gets used to it and you go through withdrawal if you stop. Then there's this bizarre paradoxical effect called opioid-induced hyperalgesia. This is where the very drug meant to relieve your pain can over time actually make your body more sensitive to it. Wild, right? And finally, of course, there's addiction, that compulsive use of the drug even when it's causing serious harm.
So, given all these pretty scary risks, how do we move forward? Well, the goal isn't to demonize or get rid of opioids altogether. They are absolutely still essential medicines. The goal is to get much, much smarter about how, when, and for whom we use them.
And the core principle of modern pain management is this. It's not about finding one magic pill. It's about a patient-centered, multimodal approach. That's a fancy way of saying we combine a bunch of different strategies, some with drugs, some without, to get the best possible outcome with the lowest possible risk.
So for acute pain, this is what that approach looks like in the real world. For mild to moderate pain, you start with non-opioid options, like ibuprofen. Opioids are held in reserve, only for severe pain, and even then, they're used alongside other treatments. It's a very deliberate, step-by-step process designed to minimize any unnecessary opioid exposure.
And you see a pretty similar logic even in cancer care, where opioids are an absolute cornerstone of treatment. The famous WHO analgesic ladder shows this structured step-up approach. You start with non-opioids. If that's not enough, you progress to so-called weak opioids, and only then, for severe, uncontrolled pain, do you move to the strong opioids. It's all about careful, methodical escalation.
Part of getting smarter also means developing better tools, and Tapindol is a great example of this. It's a newer kind of opioid that works in two different ways at once. Yeah, it hits the opioid receptor, but it also does this other thing that makes it really effective for nerve pain. This dual action means it can provide strong relief with less of a burden on the opioid system, which leads to fewer side effects like nausea and constipation. It's pretty clever stuff.
Buprenorphine is another huge innovation. It's what we call a partial agonist, which means it doesn't fully slam the gas pedal on the opioid receptor. And this is crucial because it creates a ceiling effect on the most dangerous side effect of all, respiratory depression. That's what causes people to stop breathing during an overdose. So having that built-in safety feature makes it a significantly safer option, especially for older patients or anyone with breathing problems.
But you know, getting this delicate balance right isn't just about the science and the pharmacology. It's also about making sure that everyone gets treated fairly. And this is where the data reveals a really concerning pattern. Just look at this quote. A study found that Black patients can get up to 36% fewer opioids than white patients for the exact same clinical conditions. It's just a stark reminder that the experience of pain and how it gets treated can be vastly different for different people. And that points to some really complex issues of undertreatment that go way beyond just the medicine itself. So, after all of that, where does this leave us? Well, the future of pain management is definitely not about a one-size-fits-all approach. It's about personalization, about tailoring the treatment to the individual patient, their specific type of pain, their risk factors, and their personal goals. And we can really boil this new philosophy down into 4 key steps. Number 1, always start with non-opioid therapies when you can. 2, if you do need opioids, use the lowest effective dose for the shortest possible time. 3, you have to constantly reassess. Are the benefits still outweighing the risks? And 4, and this is a big one, always integrate non-drug therapies like physical therapy and psychological support. Ultimately, it all comes down to this one fundamental question. We believe pain relief is a basic human right, but we also have a collective responsibility to prevent harm and misuse. Finding that delicate balance is honestly one of the greatest challenges in medicine today. And getting it right is going to require science, a whole lot of empathy, and a real commitment to treating every single patient as an individual.